As we take a look at health news now, February is American Heart Month, and heart disease does not just affect adults. Today, we're taking a look at pediatric heart issues, and we're so pleased to have with us today Dr. Tim Bricker from the Kentucky Children's Hospital, the chief there, and also a pediatric cardiologist, and the director and the chief of cardiology at the Children's Hospital, Dr. Lou Beazle. Thank you for being with us today.
Thanks.
We've talked a lot about heart issues for adults, but there are also some important things to keep in mind when it comes to children. One of the things a lot of parents may think about are birth defects. What are some of the most common cases involving the heart when it comes to children?
Well, Christy, there's certainly a broad spectrum of heart problems that can occur in young people, and children can be born with them. Most commonly are things like holes in the heart, which we call ventricular septal defects or atrial septal defects, but there really is quite a broad spectrum of different defects, and they can range from relatively minor problems to very complex and difficult to treat problems.
Now, you mentioned the range there. Obviously, if it's an issue with a child's heart, parents are going to be generally alarmed about that, but in some cases it doesn't really require a lot of intervention?
Many heart defects are minor holes that close on their own, and the majority of the more serious heart defects can be treated very successfully with surgery or sometimes in the cath lab without the need for open heart surgery.
Now, so many parents are told that healthy habits, that a healthy life really starts at birth. I mean, even before that, for parents, for mothers taking care of themselves. But heart disease is one of the things that you can try to prevent if you take early action with children?
Well, we know that the risk factors for adult heart disease and even some of the pathologic changes for adult heart disease happen very early in life. And so preventing heart attacks is an issue that pediatricians and cardiologists for children are very interested in. You know, if you drive by a playground in Lexington and look at those little boys playing, to realize that 1 out of 4 of them is going to suffer from early coronary disease is very sobering. So issues related to a heart-healthy diet, physical activity and physical fitness, good blood pressure control over the years are all very important to the health of children as they become adults.
And anything that parents need to be on the lookout for as signs that there could be a problem? Well,
it really depends on the type of problem, but certainly in very small children who may have congenital problems they're born with, you may see respiratory problems, you may see problems with growth or feeding, and then in older kids, sometimes you'll see difficulties with exercise tolerance, not keeping up as well as their peer group, things like that.
Well, we have a wonderful resource here, of course, with the Kentucky Children's Hospital, and we thank you guys for taking the time to share that information and the work you do with our viewers.
Thanks for your time.
Thanks for having us.
Coming up, we'll check on your forecast. Unfortunately, those temperatures we enjoyed this weekend are not sticking around. It's still winter. Meteorologist Mary Wasson is up next.